Hello there, it's Bill, the knee pain guru, and today is Monday, January 9th. I was feeling like answering some knee pain questions. This is on Facebook. It should be, at least it should be on Facebook. I got a question here from Mike Lester. It says, surgery on both knees have left him with no meniscus and arthritis has gotten worse in both joints. Have to lean forward when I try to bend down with the knee joints as they hurt so bad. Some days are worse than others. Cannot do squats or leg press. Any thoughts on strengthening my quads and more flexibility in the knee joint? I walk every day. Well, first and foremost, Mike, my thoughts on strengthening are don't strengthen anything at this point. The reason being is if you have there's an issue. The body, when the body feels pain, when the knees are in pain, the body doesn't work around. It doesn't want to go to the pain. So it compensates in other areas. The hips, the lower back, the ankles, the feet, even the tension will go up into the neck and shoulders. So if you are trying to strengthen from this place of pain, what are you doing? You're reinforcing the dysfunctional pattern that's causing your knees to be in pain. It doesn't make sense from a longevity or sustainability perspective of your joint. Now, do I think that you should never ever strengthen your legs? No, that's not true. The timing of it needs to be correct. So first and foremost, what we need to do first is get the pain reduced. So then the challenge presents itself. Well, you're supposed to do, rice therapy, where rest, ice, compression, elevation, or you're supposed to sit and rest, or maybe take some drugs or shots, and then hope when you're done with all that the knee's not going to hurt. Well, what does experience teach us? That it doesn't. It really doesn't help the knee to get out of pain. It doesn't address the neurological dysfunction, the compensation pattern essentially, that your body is doing to get itself out of pain. So what we need to do is understand the bigger picture. Your body is stuck in a pain tension loop. Experiences pain, it tenses up to protect itself. That tension reduces the space in the joint. The reduction of space causes more irritation of the nerves, causing more pain. So the more pain you feel, the tighter the joint gets, the more pain you feel. When the joint gets tighter, it squeezes out the synovial fluid, or the lubrication in the joint, causing the joint to wear further. What is a dehydrated joint? What is the doctor's diagnosis of a dehydrated joint? Arthritis. Like the doctors will put it on their diagnosis, that a arthritic joint is dehydrated. So by exercising a dehydrated joint, you make it hurt more. We have to do what we have to employ, or what we have to begin to implement, is what I refer to as pain pattern interrupts. Pain pattern interrupts gets the tiny little pressure off of the nerves in the knee. The nerves are small. So we get the pressure off of the nerves, causes the joint to relax. When the joint relaxes, it becomes comfortable. It creates a little bit of space, a little bit more space. So by creating pain pattern interrupts on a consistent and a regular basis, we set up the conditions so now your body is able to heal faster because, one, the pain is being reduced. Two, you have the tools to reduce the pain, to get the pressure off of the nerves. Now, I have in my on my website, I have several hundred pain pattern interrupts that teach you how to get the pressure off of the nerves in the different areas of the knee, be it the kneecap, inside of the knee, outside of the knee, front of the knee, back of the knee, inside below the knee joint, inside above the knee joint, outside below the knee joint, outside above the knee joint. These are all different areas that are classified as the knee. Well, we need to get specific. When we get specific, we could zero in on exactly which nerves are being irritated and how to get the pressure off of those nerves. So, Mike, in a zoom out bigger picture, like a sustainable way of getting you out of pain and keeping you out of pain and setting up the conditions so your body can heal your knee, the first step is creating those pain pattern interrupts on a consistent and a regular basis. I wouldn't at this point, I wouldn't even entertain the thought of exercise until you learn how to reduce the pain in the knee and know how to do that so you feel comfortable. And you're using pain pattern interrupts instead of Tylenol, Advil, Nuprin, drugs, shots, creams, gels, knee braces. Like any of that other stuff is just like white noise. And it's not getting to the source, which is the irritation of the nerves. So, Mike, you could thank one of the people that scheduled a time to speak with me this morning that didn't show up on the call for me having the time to answer this question. So you could go ahead and thank them. If you're listening to this video, this information intrigues you, I'm on Facebook, which is probably where you're seeing it. You can check my website out at thekneepainguru.com. You can go to my YouTube channel. I'm on Twitter. I think I'm on Instagram. I'm not much of a social media kind of guy, but anyways, you can find me. You have questions, post them down below this video. I'll answer them on future Q&A calls. And do something. Like, you don't have to be in pain. And you don't have to be relegated to like, oh, well, that's just old age. It's kind of horseshit. You can do things that can help yourself. You got to spend a little bit of time, but you can do things. And once you empower yourself with the knowledge and understanding of your body, you're going to look at the conventional medical model like absolutely ridiculous. So, hope this information was valuable for you. Mike, I hope this helped you. Reach out to me. You can schedule a time to speak with me on Facebook or go to my website. There's things on there to set up an appointment. We'll chat. We'll figure out a strategy. If I can help you, I'll tell you. And if I can't, I'll point you in a direction of where you can. So anyhow, that's what I have to share for today. Thank you so much. I really love what I do. I find the body extremely fascinating. Share this video with your friends, your family, your loved ones that are limping. It seems ridiculous. You don't have to limp. Anyways, okay, Bill, the Knee Pain Guru, signing off. Have a good day. Bye.